Good morning students, 3rd MBBS. Today we are going to discuss about from 1990 onwards to Millennium Development Goals ended, that is 2015, what were our achievements, and after that the Sustainable Development Goals started, what are we supposed to achieve by the year 2030. So this is our today's topic, that is 1990 to MDG 2015 to SDG, that is 2030. दिसते का स्लाइड याच्यात ते काही हे नंबर 2 आलं ना बघा इथे ना इथे ना So at the end of the lecture, what you are supposed to give, that is specific instructional objectives, I am going to tell you, and that is at the end of the lecture, students should be able to know the background of Millennium Development Goals and Sustainable Development Goals. Both these goals were decided by WHO. What was the WHO concept about Millennium Development Goals? Then what are the Millennium Development Goals achievements till the year 2015? And then what was decided by WHO regarding Sustainable Development Goals? What are its contents? Then what is the difference between MDG and SDG, or what is the on comparison? And then Sustainable Development Goals in India and its relation with National Health Policy 2017, which was declared after SDGs were actually formed by WHO in 2016. So, in the background, I would like to tell you that September 2000 was the year in which United Nations General Assembly, with the help of 189 countries, adopted Millennium Declaration at New York, and in that this Millennium Development Goals came into existence to establish the global partnership of countries to achieve. In that there were 8 goals which were to be achieved by the year 2015. In that basically first was eradicate extreme poverty, eradicate hunger, then to fight against illiteracy and achieve universal primary education, then promote gender equality and empower women. Then next, 4th was reduce child mortality. 5th was improve maternal health. 6th was combat HIV and AIDS, malaria and other diseases. Then ensure environmental sustainability. Develop a global partnership for development. So these were the 8 goals that were decided in Millennium Development Goal. So Millennium Development Goal adopted 8 development goals. In that there were 18 time-bound targets and 48 indicators to be achieved by 2015. In that goal number 4, goal number 5 and goal number 6 are directly related to health. 3 components directly related to health. Health also includes water sanitation and nutrition, because ultimate effects of nutrition and water and sanitation definitely are seen in the health of the person. Now, important points that were covered related to health were antiretroviral therapy for HIV/AIDS patients, long-lasting insecticidal bed nets to be used to prevent all mosquito-borne and other insect-borne diseases like malaria, dengue fever, etc. Then artemisinin combination therapy in case of P. falciparum malaria. Artemisinin combination therapy was most effective, and that is to be given to every person. That was decided. Then vaccines related to pneumonia, vaccines related to diarrhea, for pneumonia, pneumococcal vaccine, and for diarrhea, rotavirus vaccine to be made available to all the children, so that these two dreaded problems in pediatric age group can be taken care of to a certain extent, and definitely morbidity and mortality can be prevented. So, new and better diagnostic tests to be made available for early diagnosis of any illness, and these multiple diseases should be under control at the earliest. Now, what are the achievements? All this was decided in long back in 2000 and 2015 they were to be achieved. Actually, different programs are going on every day since 1990. What are our achievements till 2015? In these last 25 years, what we have achieved, that we are going to discuss in achievements up till 2015 in Millennium Development Goals by India. About India, some of them are the goals are for whole world, but our achievements of our country, about that also we are going to discuss. Goal 1 was related to poverty. In our country, in the year 1990, there were 1.9 billion people who were below poverty line. In the year 2015, 836 million people they were below poverty line. That means the remaining people, they came out of poverty. That was our achievement. Second was undernourishment was there in 23% of the population in the year 1990. In 2014, this came down to 13%. That means we could achieve it up to 23 to 13%. Then goal 2 was child undernutrition problem is almost met. The death in pregnancy, deaths in children, deaths in adolescents are to be made 1/3, and majority of them are preventable. These are all preventable deaths in pediatric age group, in pregnancy and adolescents. They are 1/3 of them, they are preventable, so they should be taken care of. In goal 5, maternal deaths, 19 times higher than developed countries. So developing countries should take special efforts in this. That was decided. Goal 4 was under 5 years of children deaths should be 8 times, they were 8 times more than developed countries. So U5MR to be reduced from 50% to its 2/3. In goal 5, that is maternal mortality, was reduced by 44%. Actually achievements were up to 75%, but we could achieve up to 44%. Then inadequate water supply and sanitation, poor infrastructure, low food security, limited education and economic opportunities. Obstacles were universal access to sexual and of dying due to maternal causes, and these maternal causes were hemorrhage, happened, and this problem was there in 1 in 37 pregnancies globally. Then universal access to reproductive health in Millennium Development Goals 5B. This was added in the year 2007. So it was laid after 7 years, it was added, and in that the 4 areas improvement was expected, and that was observed. Number 1 is about adolescents giving birth to a baby. That means the girl herself is now fully developed, physically developed, and she has become, she gets married, she becomes pregnant, and she is going to give birth to a baby. Naturally, her baby will be undernourished, underweight, and physically sometimes maybe some types of handicaps may be there. So this rate was 59 per 1000 women in the year 1990. It has come down to 51 per 1000 women in 2015. Then second was about antenatal care. It is expected that during pregnancy, minimum 4 times, every pregnant woman must reach a doctor. This percentage was only 31% in 1990. That means only 31% of the women used to go to doctor for 4 visits. But in 2015, after repeated hammering and after repeated education, the number has come up to 60%. The deliveries by trained personnel increased from 10% to 45% in 2015. Actually, delivery to be conducted by trained persons is very essential. If either a trained doctor, trained nurse like auxiliary nurse midwife or GNM or BSc nursing staff should carry out delivery, then only it is called delivery by trained personnel. Now there is one more category called DAI. Trained DAI, can we include her in the list of deliveries by trained personnel? In that the answer is no. So delivery to be conducted by trained DAI should not be there, but doctors and nurses should carry it out, and that number has increased from 10% to 45% in 2015. Then about contraceptive prevalence rate. In India it was raised up to 55%. Then unmet needs of family planning in India were raised by 21%. Now global achievements about Millennium Development Goals. In under 5 mortality rate in 1990 was 12.7 million, and this has been reached up to 6 million in 2015. That means practically 50% in 25 years. The measles immunization activity was reduced by 15.5 million, that is 67 deaths due to measles could be prevented between 2000 to 2013. That means in this 13 years period, measles immunization was covered to 15.6 million children, and because of that so many deaths could be measles immunization was given to children, and that has averted around 15.6 million deaths due to measles. The newborn mortality due to prematurity, sepsis and post-neonatal mortality, causes of pneumonia, diarrhea, malaria, they could be prevented. Then in goal 6, HIV/AIDS infection reduced by 40% from 2000 to 2014. Antiretroviral therapy has averted 7.6 million deaths from AIDS globally. 6.2 million malaria deaths have been averted between 2000 to 2015. Now about tuberculosis. Tuberculosis case detection rate has increased from 38% to 68%. That means more than practically double. The treatment success rate, successfully completed treatment, that percentage was 85% in since 2007. In India, TB case detection has increased from 64 up to 64%, and cure rate has increased up to 88%. And in India at present we have changed our strategy related to tuberculosis, and now we are saying that we are National Tuberculosis Elimination Program is started. Now infectious disease epidemic since the year 2000, where in 2003 there was SARS epidemic, in 2009 there was H1N1 swine flu influenza epidemic, then cholera epidemics are going on in many countries, and Ebola virus disease in West Africa giving rise to 28,000 cases and 11,295 deaths were there. Now in goal 7, drinking water supply improvement was there from 1990 76% to 2012 90%. So better quality of drinking water is made available from 76 to 90% of the people. Then basic sanitation facilities progress rate is too slow, uneven in urban and rural areas, and also in rich and poor areas. The reason behind it is water source availability, and for sanitation availability of toilets, that was the problem. In 2012, 2.5 billion did not have access to improved sanitation, and 1 billion people were following open defecation due to fast urbanization. But definitely now Government of India at present is taking very active efforts, and now toilet in every house they are constructing, they are giving subsidy for that, and now practically everybody's house this toilet facility is made available. Such lacunas were identified, and unfinished agenda is reflected in sustainable development goals. So fulfill the goals through the related targets. So in Millennium Development Goals, whatever lacunas were detected, they were emphasized in Sustainable Development Goals. Now, what are these Sustainable Development Goals, which started in the year 1st January 2016 and they will end on 31st December 2030. In December 2015, Millennium Development Goals came to an end and Sustainable Development Goals started functioning from 1st January to be achieved by December 30. A United Nations organization finalized the action plan, and that was given the name as Transforming Our World. The 2030 agenda was for Sustainable Development Goals. The Sustainable Development Goals, consisting of 17 goals, 169 targets, took its place from 1st January 2016. The goals are expected to be achieved by 2030. Now, what are the contents of these Sustainable Development Goals? Number 1 was infectious diseases epidemic to be brought under control, as I have given you one example of TB. Then non-communicable diseases including mental health disorders should be under control. Then poverty should end, and simultaneously socio-economic growth, job opportunities should improve, and environmental protection should be given priority. Now, the 5 P's that were supposed to be covered under this Sustainable Development Goals are people, planet, prosperity, peace, partnership. Sustainable Development Goal is defined as development that meets the needs of present without compromising the ability of future generation to meet their own needs. The implementation and success will rely on countries' sustainable development policies and plans and programs. Need of resource mobilization, financing strategies have to be adopted. Then aim was to harmonize 3 core elements, that is economic growth, social inclusion and environmental protection. Now, 2030 agenda of Sustainable Development Goal is, number 1 is to promote physical and mental health and well-being. Second is extend the life expectancy for all, whether he is poor or rich, whether he is staying in rural areas or urban areas, for everybody life expectancy should increase. Then achieve universal health average, health coverage and access to quality of health care. No one must be left behind. We have to take everybody with us and we have to develop ourselves. Then we progress in reducing newborn deaths, child deaths, maternal mortality by ending all preventable deaths by 2030. Then we are committed to ensuring universal access to sexual and reproductive health care services, including family planning, information and education. What are the targets to be achieved? We accelerate the pace of progress made in fighting against malaria, HIV/AIDS, tuberculosis, hepatitis and Ebola virus. We are committed to the prevention and treatment of non-communicable diseases, in which are included behavioral development and neurological disorders, which contribute a major challenge for sustainable development. In Sustainable Development Goal 3, related to health is the central responsibility. Goal 3 includes 13 different targets. They are to be covered under universal health coverage. So, universal health coverage is the key to achieve the challenges and to develop resilient health system. Now there were certain MDGs, that is Millennium Development Goals, which were not completed in Sustainable Development Goals. They are to be continued, because actually these type of problems are forever and they need to be monitored, and they need to be with different strategies, they need to be implemented. So Sustainable Development Goals are developing, as well as for developed countries all over the world, Sustainable Development Goals are to be followed. That was the difference between MDGs and SDGs. MDGs were only for developing countries, and SDGs are for developed as well as developing countries. So which is containing 13 targets. 13 targets related to health are 3.1 is related to maternal mortality, 3.2 is related to child mortality, 3.3 is related to infectious diseases which have been retained, were not covered in MDG, are to be continued in SDGs. Then in 3.7, that is sexual and reproductive health services, are to be given priority. 3B is access to vaccines. Then SDG 3 targets to be achieved are, in Sustainable Development Goals 3.4, new targets related to non-communicable diseases are to be achieved, which is also including the mental health. Number 3.5 is substance abuse should be stopped. Number 3.6 is injuries and accidents due on the roads, road accidents and road injuries or violence leading to injuries must be stopped. 3A is tobacco control. In any form, tobacco consumption should be stopped. It can be in the form of mishri or khaini, or tobacco smoking in the form of bidi or cigarette. All of it has to be stopped. Then reducing and managing national and global health risks. Then managing health financing and health workforce. And the 3.8, for all this, universal health care is the solution through which this education has to be given. Now targets in other goals linked to health in Sustainable Development Goal 3 are appropriate social protection systems, coverage of poor and coverage of vulnerables. Then end all forms of malnutrition by 2025. Now what are these all forms of malnutrition? Malnutrition will lead to stunting, that is less height, wasting, that is muscle development is poor, or overweight, or maybe that person is beyond or more than expected weight. That is also one type of malnutrition. So all these three types of malnutrition should be prevented in children up to 5 years of age. Nutritional needs of, then the next group is adolescents. Adolescent girls, pregnant women, lactating women and old persons. These are the groups who are likely to get malnourishment. So for them special efforts are needed. Then next is birth to be attended by skilled birth attendant. In that already we have said that birth attendant should be either doctor or nurse. Then family planning coverage should be there, that is contraceptives to be made available to each and every needy person. Then antenatal, intranatal care, then immunization against diarrhea and immunization against pneumonia are to be given. These are the new additions that are being made, and they are very effective and useful. Then all girls. Now new Sustainable Development Goal targets are for certain diseases which are newly included, which were not there in MDG, and now are included in Sustainable Development Goals, are reduce mortality from non-communicable diseases and promote mental health also. Strengthen prevention and treatment of substance abuse, half global deaths and injuries from road traffic accidents, reduce deaths and illnesses from hazardous chemicals and air, water and soil pollution and contamination. Our Millennium Development Goals which were not finished are to be continued. They are expanded in Sustainable Development Goals, and they are reduce maternal mortality, end preventable newborns and child deaths, then end the epidemics of AIDS, TB, malaria, then neglected tropical diseases, combat hepatitis, waterborne diseases and other communicable diseases. Then ensure universal access to sexual and reproductive health services. Now, Sustainable Development Goals 3 means of implementation targets are strengthen implementation of tobacco control, 3A. 3B is provide access to medicines and vaccines for all. 3C is increase health financing and health workforce. And 3D is strengthen capacity for early warnings, risk reduction and management of health risks. Now, harmful chemicals to be eliminated from wastewater. It has been observed that in a wastewater sometimes arsenic, fluorine like chemicals may be there which are harmful. If you want to recycle the water or reuse the water, then definitely before time these harmful chemicals should be removed. Then clean household energy. Household energy which is used for cooking, the gas should be methane gas should be used or biogas should be used. That is methane gas coming out from biogas plant should be used. But don't use the fuel in the form of woods or coal or kerosene even for that matter, because it is half combustion giving out carbon monoxide, and that carbon monoxide poisoning will make you problem to that woman who is cooking in the house. By adopting a fiscal wage and social protection policies and progressively achieve greater quality. Then by 2030, reduce deaths and number of people affected and direct economic loss caused by disasters by the protecting the poor people in vulnerable situations. Certain disasters are to be taken care of. Ambient air pollution, that is next. Then reduce all forms of violence and related deaths everywhere. Then provide legal identity for all, including birth registration is very, very important. Then globally, road accidents giving rise to injuries or deaths, HIV/AIDS like infection and self-harm giving rise to suicides. These are the three basic problems in adolescent age giving rise to deaths. They are to be taken care of in these Sustainable Development Goals. Children are at greater risk of stunting if they are born in rural areas due to poor education of mother, water supply is not safe and sufficient, air pollution may be a problem, and there are certain diseases like diarrhea and pneumonia which may affect the nutrition of the child, and so stunting is the problem in rural people. So in Sustainable Development Goals, that is to be taken care of. Then behavioral changes such as safe sex, condom use of HIV, reduce HIV infection, STD infection, hepatitis B infection. All these are related to the behavior of a person. They should be taken special care. Then harm reduction for people who inject drugs to prevent HIV infection, hepatitis B infection and hepatitis C infection. The healthcare safety to prevent nosocomial transmission of HIV infection, hepatitis infection and other pathogens infection. Commonest mental disorders that are seen in the community are two. Number one is depression and number two is anxiety, and these problems are there in 10% of the population, and it leads the person for suicidal tendency, which is affecting about 8.5% of the deaths in our country, and our country all over the world. India is the country in which suicidal deaths are maximum. So we have to take special care in Sustainable Development Goals. Then selected Sustainable Development Goal targets related to infectious diseases are impact indicators, coverage indicators. Impact indicators related to HIV incidence, tuberculosis incidence, malaria incidence, hepatitis B incidence, intervention against neglected tropical diseases, and mortality due to unsafe water, sanitation and hygiene and air pollution. Now, coverage indicators are all universal health care, antiretroviral therapy coverage, tuberculosis treatment, use of insecticides treated bed nets, access to safe drinking water and sanitation. Now, coverage system is 3D, that is international health regulations, capacity and health emergency preparedness. Now, risk factors determinants are access to safety managed drinking water source, access to safely managed sanitation, clean household energy, and other part of the target in goals on poverty, education, cities, climates and changes, etc. Now, specific targets to be covered in 2030 related to infectious diseases are ending the epidemic of AIDS, reduce the annual number of infected with HIV/AIDS by 90%, annual number of people dying from AIDS related causes should be reduced by 80%, end tuberculosis, 90% reduction in TB deaths, 80% reduction in TB incidence, and zero TB affected families facing catastrophic costs due to TB. Then ending the epidemic of malaria, 90% reduction in global malaria rate and 90% reduction in global malaria case incidence. Malaria to be eliminated from 35 countries. Re-establishment of malaria prevented in all countries identified as malaria free. Ending the epidemics of neglected tropical diseases, 90% reduction in number of people requiring intervention against this NTDs. Then control hepatitis, 95% reduction from this chronic hepatitis B viral infections and 80% reduction in getting new cases of chronic hepatitis C viral infection. 65% reduction in hepatitis B and hepatitis C viral related deaths. Combat waterborne diseases. No one practices open defecation by 2025. Basic drinking water and hand washing facilities in every house. All sanitation and water supply delivered in affordable, accountable, financially and environmentally sustainable manner, and adequate sanitation when at home by the year 2040. Sustainable Development Goal targets and the indicators related to non-communicable diseases are: a non-communicable disease mortality to be ended, suicidal mortality to be reduced, mortality due to air pollution to be reduced. In coverage risk factors, 3.8 and universal health coverage should be given importance in case of non-communicable diseases. In that, hypertension treatment coverage, diabetes treatment coverage, cervical cancer screening and tobacco use. Then substance abuse to be stopped, like alcohol. Risk factors determinants are clean household energy and ambient air pollution. Sustainable Development Goals related to injuries and violence, in that deaths due to road traffic injuries to be avoided, mortality due to unintentional poisoning to be avoided, deaths due to disasters to be avoided, homicide giving rise to deaths to be avoided, conflicts related deaths to be avoided. Coverage of risk factors are women and girls subjected to physical, sexual or physiological violence must be under control. Then population subjected to physical, sexual and physiological violence should be under control. Then Sustainable Development Goal targets linked with health system are coverage and financial protection of universal health coverage index, service access, that is hospital access, health workforce density by specific cadres, access to medicines, access to vaccines, and international health regulation capacities. In universal health coverage, financial protection, that is catastrophic and impoverishing out-of-pocket health expenditure. Then in the system 3B, access to medicines, access to vaccines, research and development on health issues that primarily affect developing countries, including official development assistance, health workforce density and distribution. Then IHR, that is International Health Regulation Capacity and Health Emergency Preparedness. Then data disaggregation, coverage of births, deaths and census, birth registration, death registration and completion of regular population census. This is how the digitalization can be done. Now what is the basic difference between Millennium Development Goals and Sustainable Development Goals? In Sustainable Development Goals are fundamentally different. The political context in which they have been developed and will be implemented is as follows. Millennium Development Goals had a single purpose, and that was related to poverty, education and health in developing countries. But in Sustainable Development Goals are integrated and indivisible, global in nature and universally applicable to all the countries and not only developing countries. Sustainable Development Goals cover economic, environment and social pillars of sustainable development with strong focus on equity, that is, no one will be left behind. So in this table I have tried to explain to you what is the difference between MDGs and SDGs. Point of difference first was the process of development. In MDGs it was by a limited number of experts in UNO, only 189 people had joined these MDGs, while in SDGs by a large number of consultative groups and experts drawn from various countries over the world. Number 2 is number of goals and targets. In case of MDGs there were 8 goals and 21 targets. In SDGs there were 17 goals and 169 targets. Main focus in MDGs was on developing countries with funds coming from developed world, while in SDGs both developing and developed countries need to work on SDGs. Next, third point is focus on human rights and equity. In case of MDGs, less focused on these aspects, while in SDGs have lot of focus on aspects persons with disabilities and vulnerable people. Next point is regarding compactness of the health related goals and targets. In case of MDGs, health related aspects were loose, being distributed over 3 direct health goals and 4 targets and 15 indicators, while in case of SDGs, more concentrated statement of health goals through a single health related goal, that is goal 3, containing 9 indicators and 4 sub points. What are the achievements by India as far as sustainable development goals are concerned? Now already 5 years are over of sustainable development goals. What we have achieved: end poverty and deprivation in all forms, that we have decided; making development economically, socially and environmentally sustainable; together with all, development for all; improved sanitation, health education, financial inclusion, security and dignity for all, especially women. India needs to develop a strong system for monitoring, evaluation and accountability. Government of India has already prepared a draft plan to achieve the targets laid down in the Sustainable Development Goals and have allocated the roles and responsibilities to various ministries. National Health Policy 2017 has specified the targets which are closely related to our commitments under this Sustainable Development Goals. WHO Global Reference List has given 100 contained undercore health indicators for monitoring the results. Now, prioritization of this published by WHO in 2015 to provide concise information on this health situation and trends. These 100 indicators are divided into 4 major headings. They are, number 1 is health status indicators. In health status indicators, 27 indicators, in that mortality by various age group, mortality by various causes, then fertility indicators and morbidity due to common important causes are covered. Second is risk factor indicators. This includes 21 indicators, in that nutritional indicators, risk factor infection, the risk factors of infection, then environmental risk factors, non-communicable diseases and injuries are the covered. Then third type is indicators of service coverage, in that reproductive, maternal, neonatal, child, adolescent health. Related to that, all the activities like birth, immunization, HIV coverage, HIV and TB indicators, TB, malaria, neglected tropical diseases, screening and mental health are covered. And fourth, that is health system indicators, in that a total 25 indicators. There are indicators of quality of safe of care and access to care, health workforce indicators, health information indicators, health financing coverage and health security indicators are covered. So thank you for listening. Now